Welcome to a new episode. I remain your anchor, Oliso B, and today's topic is tuberculosis. In the studio, we'll be having Dr. Guembe Ebiowei, a public health specialist that will be talking about tuberculosis. He's going to talk about the myths, the prevention, treatment options available in Nigeria. Kindly listen. If you have not subscribed to our channel, kindly like, subscribe, comment on our comment section, share, and do not forget to click on our notification button for future episodes. Welcome to a brand new episode of We Clinic. Let me get to know you, sir.
Okay, good evening. Thank you for inviting me to this program. I'm Dr. Guembe Ebiowei.
So welcome to our show, We Clinic. So, sir, can you please explain what tuberculosis is?
Okay, thank you for the question. Tuberculosis is a bacterial infection caused by a germ that we don't see called Mycobacterium tuberculosis. And it's one of the leading causes of death worldwide. As of last year, we had about 10 million cases of tuberculosis, resulting in about 1.3 million deaths. Tuberculosis is a very serious and debilitating infection affecting mostly in the developing countries of the world, like Africa, Asia, Latin America.
So how does it affect the body?
Okay, thank you. Tuberculosis has various effects on the body, depending on the part of the body affected. If it's in the lungs, it can lead to respiratory failure in the patient, it can lead to lung collapse, it can lead to septic shock. Then if it's affecting the part of the brain, we have different types of tuberculosis, but the common one is primary tuberculosis. If it affects the brain, it can give rise to TB meningitis, which can cause seizures, epilepsy, can also cause cranial nerve defects, and even spinal compression. If it's in the abdomen, it can cause abdominal pain, abdominal swelling, weight loss, fever, and even diarrhea.
All right, thank you, Dr. Guembe, for this. So what are the commonest symptoms of tuberculosis that people should
Okay. I already mentioned some things like abdominal pain, but the commonest symptom is recurrent cough of about 2 weeks. Recurrent cough. If you see somebody coughing continuously, as you have taken several medications, the cough does not seem to go, you should be suspecting tuberculosis. Also, you have unexplained fever of at least 1 week duration, unexplained weight loss. Somebody just losing weight, is taking several medications, it's not getting better, so you should suspect tuberculosis. Also have chest pain. You have drenching night sweat. Person will be sweating in the night. Even though when there's AC, you still be sweating. You should suspect tuberculosis. Also have fatigue. Person feel very weak, fatigue, poor appetite. Those are the commonest symptoms. The symptoms can vary, but those are the commonest symptoms.
So how is tuberculosis?
Yes, thank you. Tuberculosis is transmitted when an infected person coughs. A person affected with tuberculosis, if he coughs or sneezes or even speaks, that respiratory droplets, if you are in contact with the person, you likely get infected with tuberculosis. And also have to state the fact that there are two types of tuberculosis. We have latent tuberculosis, which most of us have been exposed to through the course of our lifetime. Most of us have been exposed to tuberculosis. Because of our strong immunity, we don't come down with tuberculosis. We also have active tuberculosis, which are the ones that have the symptoms of cough, chronic cough, fever, weight loss, fatigue, etc. Most of us have had latent tuberculosis. Because of our strong immune system, we don't come down with it. And about 1 out of 10 of us might come down with active tuberculosis. Maybe due to tuberculosis, maybe due to diabetes, weak immune system caused by HIV, malnutrition, tobacco smoking, even diabetes can predispose us to having active tuberculosis.
Dr. Guembe, how is tuberculosis diagnosed?
Yes, there are several modalities to diagnose TB, but the commonest one we use now is called gene expert. But in the past, some people used to use chest X-ray. We also used to use AFB smear microscopy. But there were some problems with AFB smear microscopy. They're still being used in some low resource setting. Some of those problems include it does not really diagnose extrapulmonary tuberculosis. It does not diagnose tuberculosis in smear negative patients. That the smear is saying negative, but person has TB. Also does not diagnose TB in HIV patients and in children. Those are the drawbacks of AFU smear microscopy. Where I use Zelness still and all that. But the commonest one used now, and is very fast and reliable, is called GeneXpert. Those are the two common ones we use. We also have what we call TB lamp for patients that cannot produce sputum, or for young children that cannot produce sputum, or people that are very seriously ill, they cannot produce sputum. Those are the two, but the commonest one and most reliable one used now is GeneXpert.
All right, thank you, doctor, for that. So what are the current treatment options?
Sorry. Yes. I also want to talk about chest X-ray. Some people say you can use chest X-ray with the clinical features that if you use chest X-ray and combine it, can use to diagnose and treat. But there are some drawbacks with chest X-ray. Chest X-ray, there are some other conditions that can mimic tuberculosis, so it's not really a good diagnostic. It's not really good for diagnosing. But if there is no other option, you can use chest X-ray and with the clinical features, can use and diagnose and treat.
All right, thank you, doctor, for that. What are the current treatments? What are the current treatment options available for tuberculosis?
Yeah, there are some drugs that are used to treat tuberculosis. We call them fixed dose combination. The drugs include rifampicin, isoniazid, pyrazinamide, and ethambutol. We take, if it's pulmonary tuberculosis, we take it daily. It's in a fixed dose combination. Those 4 drugs are in fixed dose, and we give you for 2 months, called intensive phase. We combine the 4 drugs, give you for intensive phase 2 months. After that, we can give 4 months just using two drugs called rifampicin and isoniazid just for 4 months. If it's extrapulmonary tuberculosis, you can take drug for as long as 12 months or as long as possible. So we mostly use those drugs. Those drugs are free and they are available in most health facilities in the country and elsewhere.
So how effective are those drugs?
I can say within 2 weeks to 1 month of taking drugs, you become smear negative. If you repeat your AFU smear microscopy within 2 weeks, or let's say 2 months, they are very effective. Let's just say like that, they are very, very effective. The problem I have is just with drug compliance, and this patient have to take drugs every day. Some patients find that one very cumbersome.
Thank you, doctor, for this explicit explanation. So the next question I want to ask: what are the effective strategies for preventing the spread of tuberculosis?
The prevention of tuberculosis. That's a very good question, because we in public health we always talk about prevention. Prevention is better than cure. So we have to start from the beginning. What is primary prevention, secondary prevention, tertiary prevention? Primary prevention involves healthy living, healthy diet, washing your hands after using the toilet, all those stuff. Then promotion of healthy living. Then another is vaccination of children less than at birth with BCG vaccine to prevent serious forms of tuberculosis like TB and meningitis. Children up to 5 years can still take that BCG, but it's not really that effective in adults. And that prevention is contact tracing of people that have been contact with affected cases with TB. With all those people that were affected with TB, can do contact tracing of their contacts, then screen them for TB and also for both active and latent TB. Also, you can also do screening for patients, for people that are at high risk of TB infection, both active and latent, like healthcare workers, people staying in refugee camp, people staying in overcrowded environments, people in jails, people that have diabetes, and people that have immunocompromised, like people that have HIV, and do screen them for both active and latent TB. So that is secondary prevention. Then tertiary prevention, early treatment, early diagnosis and treatment of active TB cases, so that you can prevent the spread to other people. Those are the strategies: primary, secondary, tertiary. So if you look at it that way, also people in community should avoid people that have chronic cough of up to 2 weeks and above. People that have chronic cough, avoid them. Then people that have chronic cough should present to a health facility for diagnosis and treatment. If it's TB, those are modalities that can use to prevent TB. Also, we should also encourage health-seeking behavior among our people. Once you have anything that is not, you don't understand in your body, just go to a health facility for quick diagnosis.
Thank you, doctor, for that. So, what role does vaccination play in TB prevention, and how widely are these vaccination services available?
I've talked about vaccination before. Vaccination for children at birth and up to 5 years is to prevent severe forms of TB, especially in children. Those TB meningitis, they're very, very severe in children. So that TB vaccine is very active and it's safe. It's safe to take and it's active for life. You don't have to repeat the dose. It's active and it's safe for life. And it's readily available in the whole country. Most health facilities, general hospitals have it. Even health centers, they have BCG vaccines. And it's cheap and it's free.
Okay, thank you very much. So what is the biggest challenge in the management and treatment of the virus?
There are several challenges, but the biggest one I think is multi-drug resistant tuberculosis because of poor compliance. And that challenge is poor. I will go back to that MDLT TB. And that problem is poor compliance because of this daily dose, daily taking of drugs. Some patients don't find it easy. It's not really their cup of tea. So taking drugs daily is not easy. So that poor drug compliance, multi-drug resistant TB, early diagnosis and treatment. Some people present very late. So early diagnosis and treatment is also a problem. Some people don't present at all. You know, they are to point very severe symptoms. So those one. Another problem is places to do gene expert are very few. Places to do gene expert are few. Some places don't have microscopy for EFV smell microscopy. So they don't have that. They don't have that kind of facility. Some people use it on clinical basis. So all those ones are still challenges. The lack of equipment, some lack of even trained manpower. So those are the few challenges I can enumerate now.
Okay, thank you, Doc. So, how can individuals and communities get involved in supporting tuberculosis awareness and prevention?
Okay. If you are coughing for two weeks or more, or you have fever, unexplained weight loss, or your neighbor, your friend, or somebody, direct them to the nearest health facility. Also encourage healthy living, vaccination of your newborn at birth. Then we also encourage good health seeking behavior. So anytime you have any symptom at all, headache, fever, anything at all, quickly present to a health facility so that a qualified medical personnel can diagnose and treat if possible any other thing at all. Just those are the things I can say for now.
Thank you, Doc. So, what will be your last word on TB to our viewers out there?
TB is largely treatable and preventable. It's quite sad that up to millions of people still lose their lives because of TB, which is largely preventable. The drugs are readily available and they are free. The problem is patients with poor drug compliance, which can result in TB having multi-drug resistant TB, which is very, very difficult to treat, and the drugs used are very expensive and very, very toxic drugs. So, what are the things like I say? TB is easy to diagnose and treat, but the problem is facilities, trained personnel, and poor compliance of the patients. TB is treatable and the drugs are free. The vaccine for children at birth is also free. So we should avail ourselves of this opportunity provided by the government and NGOs to reduce TB as much as possible.
Thank you for being part of today's episode. I hope you have learned a lot about tuberculosis, and you can kindly share your comment on our comment section. And if you have not subscribed, like, subscribe, share, and do not forget to click on our notification button for future episodes. Thank you.